So, first step in our 5-step process of evidence-based practice is asking those answerable questions, okay? As you should know by now, you've had plenty of practice doing this in classes. We want to write our well-formed clinical questions in kind of a 4-part structure. So the PICO model, right? So patient or problem. How would you describe this group of patients that is as similar to mine as possible? How would you describe the condition that your patient suffers from? And you want to start nice and specific. Lay out, I want for an 18-year-old female volleyball player who has Achilles tendonitis. Then you can always expand out. When we start talking about searching for evidence, you can alter your questions should stay nice and specific. But then when we're searching for evidence, if you're not finding what you need, then you can expand out and say, okay, well, I'm not finding 18-year-old volleyball players, right? Let's expand it to whatever age population, okay, or whatever sport. Or maybe I decide gender isn't as important, so we expand out from there. Or maybe it's not Achilles tendonitis, I'm finding other tendinopathies, and maybe I can make inferences. But the more we move away from our specific patient, the more doubt and the more cloudiness that comes back into our final decision, right? Step 4. So you got to kind of keep a note of all those things that as you move away from your patient, how much does this maybe change what I might see? And that comes from your experience. There's no good answer for that. Okay, that's going to come from your experience, your understanding of the body, your understanding of the healing process, your understanding of your patient. So keep that in mind. So P is for patient or problem. I is for intervention. So what's the main intervention you're considering? So this is great for modalities. It was a little harder when you were talking about evaluation, evidence-based practice. But in modalities, the PICO question is 100% set up for you, right? So intervention, that might be ice, right? So for my 18-year-old volleyball player with Achilles tendinopathy, does ice, and then you can have your C, which is a comparison intervention. So it might be doing nothing. It might be to just, again, kind of control group effect. It might be ice compared to ultrasound. Maybe you're comparing both those two things. And so you're probably going to end up having to search about both of those two things. Okay, so what is the main alternative? And ideally that alternative should probably be kind of the more standard of care, right? So what is probably most common that you know about that would be the intervention that this type of condition and this patient would experience, okay? And then O for outcome. So what can I hope to accomplish? What could this exposure really affect? So the outcome is key. Again, keeping in your mind about your patient and what's important to your patient. So if you've done a really good evaluation and sat with your patient and used that disablement model, the ICF, to really get at, okay, what is affecting this patient, you can get a more quality outcome. Okay. It might be return to play. So again, volleyball player, 18-year-old, Achilles tendinopathy, does ice or no treatment result in a sooner return to play? Okay, that's still broad. That's still, return to play can mean a lot of things. But maybe that's what's really important to your patient right now. Now, you might not find articles that specifically say about return to play. You might find articles that talk about pain or about range of motion or about tendon strength. An animal study that looked at the actual cell structure of the tendon. All those things might show up when you start doing these searches. Your job is to pick, how does that affect my outcome? So if I know that temperature, someone measured temperature, should temperature potentially affect return to play? And so theory, right? Theory becomes really important. Theory of that modality, theory that we know, okay, well, if it's cold within the first, acute, that was secondary cell death and that was important. But here we're talking about Achilles tendinopathy and that's a chronic condition. So the temperature in the tissue probably doesn't actually affect the healing of that tissue like it would in the early stages of an acute injury. So temperature probably doesn't help me in this case. But range of motion maybe does, okay? Or strength of that tendon maybe does. And so if you can't find exactly about your outcome, it's still important to keep your outcome in mind, but know how each of the outcomes of the studies could potentially link to your outcome. And so obviously that then affects how you establish your search. So one thing just to kind of note, I like this slide because it just kind of gives you an idea of, based on the question you might be asking, how the evidence and the type of studies that you might find or that might help you answer that question would vary. So most of what we're going to be talking about in this class is therapy, right? So the selection of effective treatments that meet your patient's values. Most of those that we're going to want to see, the studies and the type of articles that are going to give us our best answers, are randomized controlled trials or randomized clinical trials, maybe systematic reviews of randomized controlled trials. But all these other types of questions, depending on what your outcome is, depending on what your question says, you can see that different types of studies could play a role. So keep a slide like this in mind when you are starting to ask other types of clinical questions in your practice.